So first of all, I'm going to start with a funding alert. I'm sorry, I don't have a flashing screen or a buzzer or anything to sound, but just to say that the small grants for Forth Valley, which have been open now for nearly 6-7 weeks, I think, close tomorrow for applications. So these are small grants for local groups and organisations to apply for between £2,000 and £15,000 for projects and programmes of work in the local area. So that can be maybe some work that adds value to what they're already providing, or it might be some kind of new idea that they want to develop. And it's also an opportunity for new groups to maybe apply for funding where they've never done that before. So we're encouraging you, if you're in the middle of an application and you're finishing it off, just to think about the deadline being tomorrow at 5 o'clock. So we've got a few applications in, but we're expecting much more. So just a bit of a reminder around, get your application in so that you can hopefully benefit from this funding. These grants will be assessed by our funding team, and we will also draw on a local panel of experts. So we will have people with dementia, unpaid carers, and some of our local partners that will be part of a panel that will then make the decisions on who is awarded the grants. So we just keep that focus on local, which has been a really key theme throughout this morning's webinar. The other thing is that we will, as part of the funding for Forth Valley, also appoint a learning network coordinator. Their role is really to bring those awardees together as a group and to allow them to inform and share learning as a partnership. And again, just building on that sharing of information, that connection to the benefit of beneficiaries in the local area. So there'll be more information about who that will be very soon as well. So funding alert over. So get your applications in, or if you've not aware of the funding, Colm's put a link, I think, in the chat. So get your applications in as quickly as possible. Okay, so as I say, what a fantastic morning we've had. We've had some really very honest and very emotional experiences shared about the impact, particularly for unpaid carers now and throughout the pandemic, which has really, I think, opened our eyes to the really difficult things that have been happening and what people are having to cope with, but also the resilience that is around and the support that very much local communities have provided people both during the pandemic and moving forward. And I think that focus on local has been a really key thread of today's conference. From what Nicola said and in the Q&A, you know, it's important, where you live is important, and more so now than ever. I think what we want to talk about in this small section is the importance of the event, the importance of the learning that's been shared, the evidence that we have gathered to make this event happen, and also those priorities that I presented earlier on this morning. Because this isn't the end of the conversation, this is the start of a new conversation. We want this event to be a platform, a springboard for learning to be taken forward. As someone mentioned earlier on, there was lots of learning before the pandemic and lots of plans in place, but the pandemic has changed that and has shifted that, and we need to take on board how that has changed, particularly for people with dementia and unpaid carers, and look at how we revisit plans and revisit recovery moving forward. So it's brilliant to hear that Nicola and Natalie are going to be taking that learning forward within their own organisations and their own with their own stakeholders and key people that make those decisions. Because although we need the support for that to be driven forward, we also need to make sure that the support is taken into account at that kind of high level, strategic level, where decisions are made, where money is allocated, and where budgets are designed. So it'll be really good to see how those priorities reflect that. Partnerships have been renewed, I think, as a result of this event. It was brilliant in the planning groups to see lots of different organisations coming together to design the event, to develop what they want the programme to look at, and to very much reflect and be inclusive of people with dementia and unpaid carers. And it was brilliant to have May on our planning group, as well as Carice's mum Gillian. So many thanks to them, and many thanks to those other organisations and key stakeholders that were doing that. I think at the event we have seen the chat going you know, at a great pace, offers of support, connection, contacts, you know, people reflecting on how well supported they are, but also others reflecting on what else needs to happen and what improvements need to be made. And you know, some really key points there around SDS and around that idea of a community hub and the importance of that within local communities moving forward. So it'll be good to see what comes out of some of those questions and how they might inform some of that work. I think for me, just reflecting on the day, it's, you know, I think there's been some really powerful testimonies shared from carers and from people who have used services. It's been good and important to see the important role of communities and that focus on local, which is run right through, and, you know, the great support that local supports like Dementia Friendly Dunblane, our Connected Neighbourhood, the Dementia Resource Centre in Alloa, and also Town Break have played in the lives of people receiving that support. So we want that to continue, and we want to build on that, because the heart of all this is care, as we discussed as part of the priorities, and care is at the heart of everything that we do, and we all have a commitment and a want and a need to continue that. So this is my call to action to you as part of this webinar. Use the learning, use the discussion, use the debate to inform your own work, whether you're an individual living in a community, whether you're someone living with dementia, an unpaid carer. Use the learning that you've seen today, whether you're part of a small group or organisation that wants to utilise it, then do that, take it away. Whether you're part of a bigger organisation, you're in the NHS, you're in the local authority, everybody has a responsibility to do something with what they've heard today, and we would welcome you to take that forward and use the learning. All of it will be put onto our website. Everything's recorded today. There'll be a full recording of the website there for you to access openly. Each presentation will be put on separately as well as the priorities, so you can take away whatever learning you feel is meaningful and important for the work that you're doing. We want to give you as many tools to be able to use what we have developed in partnership locally with stakeholders for Forth Valley. We will also have a full and detailed report from the Village Storytelling Centre with respect to the sessions that have taken place so far and the additional sessions we hope to have, so that there's more context around those priorities and you can actually see in more detail what was expressed and the examples that people shared in terms of the experiences of their lives. So lots of tools, lots of evidence, lots of learning to be able to utilise. I think the priorities are rich, and I think they have meaning and they have legacy, and we will be happy to support anybody around discussions within their own organisations about how they may be taken forward. We have many examples of how those priorities have influenced change locally. Examples coming from places like Orkney, where we did an event in 2019, where the priorities and learning from their event have now shaped their local dementia strategy, which was launched in September 2020. We already are seeing discussions happening in Fife. It's great to see a question from Jerry, the stand group, and the event there and the priorities that have been shaped and the learning is now informing how they move forward with their local dementia strategy. And more recently, an event in Tayside has now stimulated and encouraged partners in the Angus Health and Social Care Partnership to do similar work. So lots of examples of how positive moving forward can take place as a result of these events, and we would encourage anybody to have a conversation with us at the Trust if they want to be connected with some of those other areas to hear more about the work that's underway.